Agreed. Let me throw in a question that I get over and over because years ago, our group and other groups pushed the use of Proscar and Avodart a lot. And back in the 1990s, we didn't have very many effective therapies. And when you look at the mechanism of action of blocking dihydrotestosterone, which is a more potent form of testosterone, it sounds so logical that we would put people on Proscar and Avodart during intermittent therapy. And we actually showed that it does kind of keep the PSA down. It has some activity. But there's been a whole literature, and you're probably aware of this, Mark, about the possibility of lingering suppression of the libido with the use of Avodart and Proscar. In fact, there's a lot of litigation going on about this now. And I personally, along with my partners in Marina del Rey, have sort of steered away from using, because the goal of stopping Lupron and getting testosterone back is to restore libido. That's one of the goals. And so even though the PSA rises more slowly with Proscar and Avodart, we've shied away from it probably in the last 5 to 10 years. And because we've frequently seen this problem with suppressed desire. And have you encountered that as well?
That's interesting. I mean, I again, if I look at the literature, there has been more of a scrutiny over who to use this with. And I mean, some guys require it and need it because of BPH, because they have large prostates, and that's understandable. But you don't have to be a genius to realize that when you're taking away the most potent form of testosterone and you're affecting, for example, ejaculate volume, right? You're doing, clearly something is changing in the prostate, in the area around the prostate, that when people are coming back and saying that they have libido issues, those are relevant. Those are really relevant. And
so whenever I prescribe this medicine, I always warn them that about a third of the men will experience rather immediate and persistent loss of sex drive, loss of libido. Thankfully, it is reversible if you get off it pretty quickly. But I think all the litigation is about that for the men that stay on it for a couple of years, some of them apparently, I can't prove this, but some of them are not recovering their libidos.
That's interesting.
So there's a lot of anger and concern that maybe that this needs to be explained more. Now, when you look at the package insert, it talks about the loss of libido, and I don't have any agenda against the companies. I'm very glad that we have this agent. Like you say, it works well for men that have troublesome large prostates. And maybe over half of the men don't have libido problems. But you better be careful when you start it to be vigilant for that loss of libido, because it could, and perhaps, it's not proven, but perhaps it could be long lasting.
Yeah, because you also have to be careful what you ask for. And there's also all these young men who are taking this exact same drug in a lower dosage for hair loss. Because remember that these 5-alpha reductase inhibitors, about a fifth of the dosage is the exact same drug approved for hair loss in men, like Propecia.
Yep.
And we know that that can also bring PSA down, and some men have complained about libido there. So there are men who are taken off of it but continue their hair loss drug, right? And they wonder what's happening. So there has to be a discussion that the number one selling hair loss pill is just another form in a less of a dosage of the exact drugs you're talking about that you're concerned about. So both of those have to be brought up.
Yeah, what you mentioned briefly about how the PSA is lower, and now and then some less sophisticated family doctors are missing prostate cancers at an early stage because they think the PSA looks fine, but they're taking Propecia.
Yeah.
Why don't you mention that?
Yeah, they're taking Propecia, exactly, or they're taking dutasteride or Avodart, and that has a half-life that's much longer than Propecia, and it takes longer to get rid of the drug out of your system. You know, you're talking about weeks to months versus days, and I think the point is that they've got to look at the entire list of what they're taking, because there's some repeats there.
And plus, with the PSA being lower, sometimes they're not getting a biopsy or an MRI in a timely fashion. Let's say your PSA is 3.9 on Propecia. We're supposed to double that number, right?
Right. That's right. But don't you think it's an amazing thought? I've always thought, how ironic is it that a drug that's pushed to maintain youth or have you look essentially younger in a number of people robs you of the drive that's also supposed to make you feel younger. So there's a disconnect, right? You can't have both. right?
I know. I've had some amusing conversations with patients about this, and where it's kind of like I warn them. I say, "Okay, you've been taking this Propecia, it's working, but you've complained of a low sex drive. But if you stop it, it's possible that your hair is going to start falling out again." And of course, I figure, dang, Dr. Scholz, I didn't realize that. I'm going to stop it immediately. And I've had several patients say, lose my hair.
Yeah. Yeah.
And I think I'll pick the hair over my libido.
I know, but people forget that the over-the-counter game is changing, and that's where I become so busy. The over-the-counter world is totally different from 10 years ago, and 10 years from now will be totally different. What that means is that, there's still 2% and 5% minoxidil over the counter. Yes, men got to apply it every single day, but there is absolutely no evidence that I'm aware of that applying minoxidil over the counter to your hairline is going to cause any testosterone or libido issues.
There you go.
It can dry your scalp.
Alternative. Yeah,
that's right. So you're not. It's not all or isn't this the lesson of why we have these conferences? Mm-hmm. It's not all or nothing.
Yeah,
there is a middle choice.